country here to visit with us about the major issues and legislation coming out of Washington. Kevin Brady represents the 8th District of Texas in the U.S. House of Representatives. The 8th District encompasses 11 counties, including Montgomery County, and regions from the I-45 corridor east to the Louisiana state line. With the time that we have today, Kevin Brady is going to offer us the very latest developments on what the National Health Care Plan President Obama recently signed will mean to families and businesses in Montgomery County. He will also save time for some of our questions and answers. Please welcome our U.S. House Representative and good friend, Congressman
Mandy, thank you very much for having me here today. Thank you for taking time from your busy lives, but this issue is so important. It affects so many of us, ourselves, our kids, our grandkids, that we're thrilled. Bill's invited us to be here. Mandy, Tiffany, thank you all for being here. I'm also joined, by the way. My wife, Kathy, is a certified angel. I work in Washington, but I live here. And for 7 terms, I've commuted back and forth every Monday to Washington. I come back at the end of the week. She raises our 2 boys almost by herself. She had to leave yesterday on short notice to see a friend who's battling her last days with cancer, so I'm kind of Mr. Mom today. But I've got my sons, Will and Sean, over there. Can you guys wave? Yeah, they're here. They were at the Tea Party rally last night, so try not to be quite that boisterous, okay, today. It was a great meeting, by the way. We all support health care reform. There are many things we can do to make health care better. The question is that 2,500-page bill, $2.5 trillion expansion of government, the right solution for you and the right solution for America? I don't think it is. I don't think bigger government means better health care. In fact, in some ways, it makes it worse. I want to tell you a little about the bill and take plenty of questions, have plenty of time for questions. But we are still sifting through this bill. It's so huge. They rushed it through at the end. There's so many special deals, and we are still learning every day. But I want to talk about 5 things you may not know about what's in this health care bill that do affect you. And the first is that businesses are actually, in this bill, encouraged to drop their health care coverage. This is what they do. This whole bill is centered around government-approved health care. You have to have it or pay a tax. Companies have to have government-approved health care or pay a tax. But under this bill, if you're a company and you've got workers, you provide them health care, but they decide it's not government-approved, you pay a fine of up to $3,000 per worker. But if you don't offer health care at all, the fine is only $2,000 a worker. Think about that for a minute. If you're trying to do the right thing, give health care to the folks you work with, but the government doesn't like it, you pay more than if you just don't offer at all. So our fear is businesses are going to look at the bottom line, especially small businesses, medium-sized businesses, and decide, it's just cheaper for me to not have it all. You guys just get it to the government and run the exchange. Our fear is that's going to happen. And what we're worried about is in this bill, there's one that took away an incentive that we put in place about 7 years ago. We were worried about retirement plans that companies had for their workers, and they were dropping. It was just a steady trend down with the number of companies. And so in the prescription drug bill that was passed in 2003, we put in an incentive. We said if you'll keep your retirement plans for your seniors, the federal government will pay 28% of their medicines for it, because that was a big driver. And it worked. It leveled out. Businesses kept their plans, so it's worked exactly the same way. Under this bill, they take away part of that incentive. And so we expect companies are going to start dropping their plans. We're worried about 6 million seniors will lose their plans because companies drop it. And if you've been reading the papers lately, you've heard about companies like AT&T, Verizon, John Deere, Caterpillar, who've already put out major charges, tax charges, they'll have to pay as a result of this bill. And small businesses who really, I think, need the most help, excuse me, I've got these allergies I can't seem to get rid of. They have tax incentives to help small business in this bill, which I think are good. But the way they designed it is so limited that the National Federation of Independent Businesses, NFIB, which really does a good job of keeping track of the impact on our small businesses, they estimate that 90% of all small business workers, 9 out of 10, won't be eligible for help at all. And the way they design it really, if you're a small business, as long as you stay under 25 workers and you don't pay them much more than $25,000 a year, you'll like this bill. But if you're hoping to grow and you want to pay your workers more than that, you lose benefits and help every step of the way. That's why we have a big worry that this health care plan is going to encourage businesses to drop their coverage for workers, which would be a huge shame. You're going to pay more for health care under this bill than before. Let me talk mainly about folks who are working today. The cost is going to go up. That's because government-approved health care is a series of mandates, requirements by the government. Your plan did this and this and this, whether you need it or not. Those mandates, some of them we would support, like covering people with pre-existing illnesses, needs to be done. You know, if you've got chronic disease, cancer, a heart attack, diabetes, it's hard to get covered. So I agree with those mandates, with something like that. But they have new regulations on preventive care, appeals process, just item after item. It's going to drive the cost of health care up. They require, for example, younger workers and healthier workers to pay more in their health care than they did before. They actually limit the discounts they used to get if they were young and healthy. That goes away in this bill. We're worried about, again, health regulations in the bill. One of our worries that adds to the price of health care is what they call cost shifting. This is what happens when, in Medicaid, in a severe way, Medicare in an important way, the government doesn't reimburse our doctors or our hospitals very well for the treatment they give. And so these doctors and others, if they lose money on a Medicaid patient, and a person walks in with private health care, guess who gets the bill for that? As a result, over the years, that's added a lot to private plans. Under this bill, the way they cover a half of the 32 million people they want to insure is they move them in Medicare, which pays 60 cents on the dollar. So the worry is, again, that cost shifting is going to go into high gear, get pushed on those private plans. And Medicare estimates, and the Congressional Budget Office estimates, that the average health care plan for a family of 4 will go up $2,100 a year, more than if this bill didn't exist at all. So this one's actually going to drive up health care costs. And again, I think the alternative that I and others presented for health care reform, we focus first and foremost on driving health care costs down. Because that way more people can afford it, fewer people will be uninsured, and you help the process. But very little of that is in this bill to help us lower health care costs. So we're worried about that. And one of the models we looked at to figure out how this plan would work is the state of Massachusetts. Is there any of you guys from Massachusetts? Okay, I can really talk about them. Massachusetts put in a bill very similar to this, a health care plan in 2006. Got geared up sort of a year later. So they've been in it 3.5 years. Now they have covered 97% of the people in Massachusetts now have health care. They're mandated to, or they face a tax fine just like this bill. But it comes at a price. They now have the highest health care premiums in the country. They spend 33% more per patient than they did before that bill took place. The average time to see a doctor, just a routine visit to your family physician, is now over 3 months. They are starting to run out of money already. Their Massachusetts care is called MassCare, the government plan. When you do need help, they deny claims 4 times more often than the private insurance plans because they're running out of money. And they've already started cutting what they reimburse hospitals, and they pulled back coverage they gave to some families. They pulled it back and just said, I'm sorry, the budget won't allow it. Now that's in 3.5 years. They pay higher prices, they have slower care, and rationing has already started. That's our worry about this bill when it gets going. It'll have the exact same effect. And what worries me is that now almost half the doctors in Massachusetts won't see new patients. I mean, they're sort of at the end of the road. They added no new doctors, no new nurses to take care of everyone. And so my worry is that's what's going to happen in America as well. You know this one. Well, meet Uncle Sam, MD. The government is going to be more involved in your life than ever before. They have, in this bill, they cut Medicare over $500 billion. Hospitals, home health care, nursing homes, hospice, all across the board to pay for this new bill. But they also added 15 new taxes up and down the board. Everything from tax on insurance plans to medical devices that doctors and hospitals buy, bedpans, beds, syringes, masks, oxygen tanks, all that. New taxes on people who make more than $200,000 a year, and businesses, small businesses that make more than that, have a new Medicare tax, a new investment income tax. There's a tax if you don't buy government-approved insurance. There's a tax if your business doesn't offer you government-approved insurance, on and on and on. So many that they estimate that the IRS will have to hire over 16,000 new federal agents just to enforce this bill. Well, most of us thought about health care reform. We thought they were talking about more doctors' exams, not more IRS exams. And if we need 16,000 anything, it's more doctors and more nurses in America. And so this is the largest expansion of the IRS since withholding began in World War II. That's not really what we were thinking about when we were thinking about making health care better for America. The fourth thing in this bill you may not know is that some seniors are going to lose their Medicare Advantage plan, and most seniors are going to pay more for their prescription drugs. Here's why. This new Congress and this president, they don't like Medicare Advantage. It was an option we put in place about 5 years ago from Ways and Means Committee. What we were looking to do was, especially in rural areas where your healthcare choices aren't very great, and in communities where, minority communities, others where there aren't as many choices as you'd like, we paid private plans to bundle the services so you get preventive care, your medicines, your doctor, and your hospital all in one plan. We wanted that option. Now it's become very popular. I think 1 million seniors in Texas have a Medicare Advantage plan. My guess is a number of you in this room, because they're very popular. They don't like it, so they cut them dramatically, cut their funding for them. So according to Medicare, 1 out of every 3 seniors will lose their Medicare Advantage plan. And the other 2 that keep it will pay about $816 more each year for that plan. It's very frustrating because, Medicare itself isn't insolvent. Those cuts that they're doing, they don't strengthen Medicare. They just go to pay this new plan. And what worries me is that I hear the president today saying, well, we've closed the donut hole in prescription drugs, but they haven't. And let me explain why. You may remember when, our committee, Ways and Means Committee, we developed the Medicare prescription drug plan. I believed in it then, I believe in it now, I still believe. I would rather spend a dime in medicines to keep you healthy than a dollar when you go to the hospital or get a surgery that you didn't need that we could have prevented. Common sense says, keep you healthy. It's good for you, it's good for society, it's good for your grandkids to keep you healthy. But when we were putting the plan together, we focused really on three groups. One was the average senior in Texas and in America. So the first part of the prescription plan is just like an insurance plan. It's a copay up to, I don't know what we have today, $2,500, $2,700. What is it? Is it 25? About, and we set it where about 90% of seniors would fall within the traditional insurance part of that. Then we looked at seniors who, about 6% of seniors will end up with an illness or a combination of illnesses that require very expensive medicines, or very expensive treatments that they can never hope to pay. I mean, literally, never hope to pay. So we put a catastrophic plan in place so that no one would ever in America, no senior ever again, would have to sell and go through everything they've earned in their life just to get this. And that middle, the group that was left, about 1 out of 10 seniors, fell in what they call the donut hole, where you provide the coverage yourself. Except, what we did was made sure in every state there were a number of insurance plans to cover them. In Texas, we have 11 plans that cover seniors all the way through the donut hole, for a range between $45 and $90 a month. So for those. But in this bill, they said we're closing the donut hole, but they don't. They restrict it, constrict it for a few years, and it bounces back full. They got some discounts from the drug companies to help with the brand name drugs, but for the most part, what they did was they said we're going to help those who fall in the donut hole, and we're going to raise prices on the 90% of seniors who don't fall. That's sort of the problem with this whole bill, is that the way they want to provide health care is to raise prices on those who have it and give it to those who don't, rather than focus on lowering health care costs all across the board, which I think is key. And I'll tell you, I don't bash the big drug companies because we've got companies here in South Montgomery County, the Woodlands, who are trying to bring new drugs, life-saving medicines to the marketplace. It costs them about $1 billion to do it. Most of their trials never make it through. It's very risky, and when you finally bring a medicine to market, it's really sort of a miracle. So, I don't bash drug companies just for fun, but in this bill, when they talk about winners and losers in the health care bill, everyone agrees that there was one winner, and that was the big drug companies. They made a gamble, political gamble early on, that they would support this bill in return for an agreement that protected them. And that's what they did. They hired over 1,000 lobbyists, 1,105 to be exact. Not that I'm counting, but 1,105 lobbyists. They poured $50 million of advertising in support of this plan. Then they sat down at the White House and congressional Democrats, and they cut a deal. They said, we'll provide discounts for brand name only for some of the seniors in the donut hole, but we want to be protected. And they were. They're protected against government negotiating prices. They were protected from reimportation, so you can't buy it from Canada or other parts of the world. They were protected on price controls against them, and then they got an agreement where they protected their brand names longer, so generics are slower to the market. So they did fine in this health care bill, and you're going to see their profits do well. Again, I don't bash them. They were playing that political game, but the winners in healthcare ought to be the patients. That ought to be who comes out ahead in all these, and unfortunately they don't. The reason I finished the fifth thing you may not know about the healthcare bill is this question mark, is because there are so many questions about this bill. That Senate bill that was rushed through, all those special backroom deals, all that, which, by the way, they're all in there. The Cornhusker kickback, they didn't do away with it. They just expanded it to all the other states. The Louisiana purchase, the $100 million for hospitals in Tennessee, the special deal for Hawaii, Connecticut, North and South Dakota, the Midwest are all in there. And guess who pays for it? You and I. Absolutely. But we don't know what's in this bill. It was the Senate bill. If you remember, two bills went to the president. First the Senate bill did, and then the reconciliation, the fix to the Senate bill. The problem is they never dreamed the Senate bill would become law. So it's slapped together. It looks like, you know, if any of you are teachers, you remember the student who came rushing in at the end and shoved his homework in, scribbling it while they were finishing it? That's almost what they do in this bill. The Senate bill provisions conflict with each other. Many of them are nearly handwritten and very vague. They don't define much, and it's now the law of the land. And the reconciliation bill that fixed it was based upon the Senate bill. So you got confusion already, Randy. I'll tell you, my Ways and Means staff is pouring through this bill as we speak. My Joint Economic Committee staff is pouring through it. So is my district staff to find out what it means. And already we're seeing flaws in the bill. For example, I keep coming back to government-approved health care because, again, that's what drives this. They listed in the bill all health care that is already government approved, except, oops, they forgot to include our military and our veterans in their definition. So they would face, if the bill, if you actually did the bill and enforced it, they would have to pay a tax. Our military to TRICARE and our veterans. Well, they went, oh my goodness, so we goofed that up twice. So they had a third bill last week to try to fix it, and they fixed the TRICARE part, but they missed about half of the veterans part of it. They let that out again. The American Legion, the VFW, came out of their seats last week. They said, quote, "This is an act of betrayal," unquote. And they privately they were saying, they were pleading, "What are you people doing? You know, please slow down. Please get this right. This healthcare bill is too important to get it wrong, and you're going to affect our seniors, men and women who fought for our country. You're going to pay a price because you guys won't slow down and listen to us." That's one example. That came up right away. Another one. You heard the president the other day say, from this day forward, if you're a child with pre-existing illness, you will be covered from this day forward. And I know he meant that. The problem is, the bill doesn't say that. In fact, the bill says, if you're an insurance company, you don't have to cover kids with pre-existing illness. And if you do, you don't really have to pay all that until 2014. So, they're now, yesterday, you heard the Secretary of Health and Human Services say, well, by regulation, we're just going to make that happen. That's our worry, is that too much of this bill will be decided by government bureaucrats who don't know us, don't know the impact, but they'll just write it like they want it to be, which means you and I have no input into this. There are so many questions, but there is one question we don't have, because we already know the answer. We can never hope to pay for this bill. It is so expensive, I cannot begin to describe it to you. In the first 10 years, the deficit on this bill is $660 billion. On top of Medicare, which is close to insolvent, Social Security, which actually paid out more than it took in this year, on top of the $1 trillion deficits we're running every year right now, and we will for a decade if we don't stop spending. It's projected to be $1 trillion deficits for a decade. And at that end of that decade, we'll be so deep in debt. Our debt will be almost as big as our whole economy, which puts us in the level of Greece and Spain and Portugal and banana republics, countries whose books are so far out of whack you can't really have confidence in them anymore and drive up your interest rates. That's the way we are headed. And it worries me because, honest to goodness, we're no longer talking about whether your kids can pay all this debt back. They can. Now we're talking your grandchildren. And maybe not them either. It is so deep. And that's our biggest worry has been, why take on a huge new entitlement when our focus first should have been on, let's work together, Republicans and Democrats. Let's find those ideas we can agree on. Let's focus on lowering costs. That will really is what I think most Americans want to see happen.